Hello, everybody. I'm Dr. Jones. I'm going to go through your orientation. Let me share my screen. Okay. So welcome to the family medicine orientation. We'll get started with the objectives. So first off, we want to specify the requirements of passing the family medicine rotation. Obviously, very important for everybody, and we'll talk about how to do better than passing, but try to do well. And we'll cover important policies for the rotation, state the requirements for the didactic sessions, requirements for student professionalism, and areas of personal bias that may prevent equitable care. And this is the contact information. One note here that I want to make sure that you guys are aware of. Anytime that you are going to email me, please go ahead and also copy Shandy, unless it's about Shandy, of course. But please go ahead and copy her every time. She knows how to personally get a hold of me if there is something urgent / emergent. So it is in your best interest to do that every single time if possible. And most of the time, whenever you have a question, it'll be in the instructions for your assignment, or it'll be in your syllabus. And I know there's a GroupMe chat as well for your month that you can also easily ask Shandy questions in. So perks of the rotation, you guys, I know are all in different settings, but a lot of you are in the community setting, some of you are in the academic setting. But regardless, you'll be working with a variety of healthcare professionals, whether that's communicating through notes, charts, chats, or physically speaking with them in the clinic over the phone or in person. And with family medicine, practice management is very important. Lots of billing and coding things like you guys don't learn in your preclinical years that you'll get exposure to. Lots of interaction with specialists. Our big role as family medicine and primary care is acting as orchestrators and coordinating lots of things. There's lots of appointments where a majority of it is going over the specialist notes and making sure that the patient understands what the specialists have talked about with them, and understanding what the patient's understanding is. And because a lot of the time they'll leave those appointments and say, oh, the nephrologist said this, and their note says something very differently. So kind of just reinforcing those things, but also with family medicine, our patients trust us so much. And I mean, I can't tell you how many patients I have that will not do whatever another doctor tells them to do unless I approve of it. They have to go over it with me before they will implement what a specialist says or what the doctor told them while they were inpatient. So a lot of coordination there. We do a lot with a pharmacy. We are fortunate to have a couple of clinical pharmacists working directly in our clinic. We have one that goes back and forth from our inpatient to our outpatient. She spends half of the day with our inpatient team while we round, and then the other half outpatient with us in clinic. And then we have another fully outpatient clinical pharmacist, and they are extremely valuable for us. Other perks is that we, I mean, you can branch out from family medicine in so many different directions. From our residency, we have people that have gone to sleep medicine, palliative care. They've done hospitalist, ER fellowships, um, sports medicine, obviously, OB fellowships, um, and such a wide variety. We had a few clerkship directors ago, one that left to go work in Alaska, and could make in Alaska working 6 months out of the year more than I would make an entire year. You could go be a cruise ship physician, a resort physician, work at Hobby Lobby. There's so much variety. Duty hours with our rotation is the same as it would be on any other rotation. You can see the full policy in Leo under course information. But just like any others, you are not allowed to work more than 80 hours per week, averaged over a 4-week period. You have to have a minimum of 1 day in 7 of clinical work and required education, 1 day off in 7. And that your work periods should not exceed 24 hours of continuous scheduled clinical assignment. You should not get even close to that on family medicine. If you are getting even close to that, I need to know, because that should not be happening. Student abuse policy. Again, the full policies are on Leo under course information. As adult learners, we want to treat you as adults. And we are wanting to expect certain things out of you guys, but also expect certain things out of our preceptors. And so if there are any problems whatsoever, please let me know. I do have to have those difficult conversations sometimes with our preceptors, and we've had to let some of them go. If there's even anything where you're like, well, this wasn't necessarily something wrong, or I don't think that they should get in trouble for it, but I just want to make you aware that this is happening, or it felt awkward, or anything like that. I highly appreciate that, because things like that if there are patterns, probably would warrant conversation. And whenever you guys tell me things, of course, you guys are my priority, and I want to protect you all. So I recognize that, we have to be careful with when we bring up things. But even whenever you guys submit evaluations, we don't give preceptors those feedback right away, or else it can make it easier for them to pinpoint which student it was. But with evaluations, we wait several months and before we give that feedback, so that they don't know exactly who it was saying whatever it is about them. So all of the course information, including your syllabus, easily accessible on Leo. You guys will be using Leo quite a bit for our rotation, for all your other rotations. If you're later on in the year, you should be very familiar, but in case you aren't, it'll look like this. You'll go down and find your year. This is obviously your year will show up on that, and so you'll scroll and find and click that. Okay, all your materials, your course information, and then our course is organized by the dates, by week 1 first day, week 1 last day, week 2, week 3, week 4, and all the documents are listed under each of those days. You guys should have already turned this in, but these are your personal goals. These personal goals, if you have not already, you'll want to go ahead and jot down your personal goals on your mid-goal feedback form. That mid-goal feedback form is that form that Shandy should have given to you guys earlier. But at the top, you'll have your goals for the rotation. Okay. and we'll talk more about your medical feedback form here in a little bit, but evaluations, I actually got rid of the majority of evaluations that you guys used to get. I am a big believer in not doing busy work. There used to be evaluations for after every single session. In exchange, though, you guys have to promise me that if there is somebody of notable achievement, a lecturer that you thought did a good job, or somebody that did the opposite that you thought was not so great of a lecturer, I would appreciate that feedback. There's only one evaluation now that you guys are giving, and so even if you don't remember the name of the person that gave it, but you know which week it was, or you know what topic it was, if you jot that down for us, that would be greatly appreciated. Or, if there's an email that you want to send, that would be fine too. I just do need that information, and that end of course evaluation is a requirement for you to complete for us to finish your grades and assign your grades. Okay. This is the PET logs that you guys also should be familiar with from other rotations. But it is a requirement through the dean's office to have these PET logs completed. And our course has 20 patient encounters that are required. Now, I want you guys to draw special attention to some of these, because these are some common questions that I get. But so number one, just like in other rotations, if you don't see this case in person, then you do have an alternative assignment. Okay, we really don't want to give you extra work. We don't want you to have to do the alternative assignments. But the alternative assignments are listed under week 4 if you get to that point and find things that you have not done. But to clarify some of these, for assist in breast cancer screening, for example, some people have asked, well, I didn't do a breast exam, so I didn't get that to count that. If you are asking when was their last mammogram, or are you up to date on mammograms, or you review and find in the chart their last mammogram, that is assisting in breast cancer screening. Okay. Because if you look down further, assist in colon cancer screening, none of you guys are going to be doing colonoscopies, right? So again, that's just if you're asking about when their last colon cancer screening was, or finding that information in the chart, asking the patient, etc. Okay. One that is one of the more commonly difficult ones to get for some of you is, excuse me, a patient, an adolescent patient. And a lot of that kind of just depends on, a lot is just look at the draw. But I know some practices have more older patient population. So I would highly suggest that you have this in mind, that is a requirement, and you express that to your preceptor so you can be looking forward on the schedules for that. And if they, matching up your days for when you're going to be with that person and when that patient's going to come in. And if there aren't any of those, then you can see if any of their colleagues are seeing an adolescent and saying, hey, can I go see this patient with this person so that I can meet this requirement? It might take a little bit of planning, because excuse me, I have a tickle in my throat. Adolescents are usually, relatively pretty healthy, right? So they're not coming to the doctor all the time. They're kind of past the point of routinely coming in for well child checks, and they're not yet old enough to have all the chronic conditions. So you might have to look a little bit harder for that opportunity. Okay. And this is that book that Shandy gave you with the recommended readings to go along with your studies. So that mid-goal form that Shandy gave you guys, please make sure that you have it completely filled out, all the blanks filled out, your preceptor signature at the bottom, ready to turn into me the same day that you do your OSCEs and your EBM assignment. It's that week 3 OSCEs, okay? Never fails. I have at least one of you that says, I didn't realize that my preceptor wasn't going to be here this day. So I don't have it signed. I didn't get to go over it or something. So again, you'll need to look ahead and see, especially if you are at a location where you're not with the same person every time. You might need to look, okay, I don't see this person from this week to this week, and so I'll need to make sure I get their signature on this week or this day. Just plan that ahead a little bit, and make sure that you have it signed before you bring it to me. If you lose it, you can print another copy off of Leo. Digital copies are also fine. Whatever you need to do with that. But make sure all the blanks are filled out. Also to clarify, that paper that you guys fill out, it asks you if your preceptor has seen you do a physical exam, do an interview. And that is information for me to know if that preceptor is doing those things. It's not a requirement. They don't have to watch you do those things. It's just information. However, you will get a survey later on, asking you if anybody has seen you do an interview or a physical exam. For every single one of you, that should be yes, because of your OSCEs. So make sure that you put yes on those. 100% of you should be saying yes, that you have been seen. You have been seen doing a physical exam, you have been seen doing an interview, because I am watching your OSCEs. Okay. Let's see. I think that's it with that. But mid-goal feedback day, 3 things. You're doing your OSCEs, mid-goal form, and your EBM assignment. Okay, and that's that form that you guys have. And then this box right here, sometimes people forget to fill out with their yeses and nos. Make sure those are all filled out too. And also this blank up here, the number of pet logs that you have done. Okay. So whenever you guys show up for your rotation, day 1, please make sure to go over expectations, your goals, etc. Let them know that you want to do well on the rotation, that you would like to do your best and try to get an A, and that you want to know what their expectations are for an A. And ask them to give you specific feedback frequently. I highly suggest that you continuously ask for feedback, and specific feedback. If you ask them one time, how am I doing? And they just kind of say, oh, good. Then maybe at the end of the day, say, hi, can you give me some specific feedback so that I can make sure that I'm earning a grade that I would like out of this rotation? I I do an orientation with all of the preceptors, and I ask them to be honest and open with their feedback with you guys, to be fair. Because it's not fair to you guys to tell you, oh yeah, you're doing great, oh yeah, you're doing great, and then slam you on your evaluations at the end. So I do ask them to give you specific and frequent feedback, but you may have to remind them to do that. Here is the breakdown of your grades. Okay. We'll talk some more about some of these specifically. For the grades 89.5 and above is an A. We do round that up. You have to pass clinical performance, final exam, and OSCEs. That says 70%, but the final exam, you just have to get a 60 or above to pass because it is a hard test. I mean, there's multiple versions of the test, but they are hard. For clinical performance and OSCE, 70% or better. For the final, 60 or better to pass. And then upon retake, if you do have to retake it, which I hope that nobody ever does, will be the lowest passing percentage score. So if you do have to retake the final exam, you would only be allowed to get up to a 60. We need the patient log completed, or it's an incomplete. Unprofessional behavior may result in a failure of the course, and I will talk about that as well. So with clinical performance, professional behavior is very much expected, including absences. I need to know ahead of time if you are needing to miss anything. If you choose to just not show up to something, that can result in a failure of the entire rotation. And the reason I take that very seriously, and our preceptors know to tell me if you are not there, is that this has resulted in us finding out about problems with mental instability, so depression, suicide, drug use. And so if you don't show up and you do not answer phone calls, you will have a wellness check, so a police officer coming out to your home. I, again, do take this very seriously, and I need to know about these things ahead of time. All right, so as I mentioned, for the shelf, 60 out of 100 is passing. You get 2.5 hours for 100 questions. And it is a NBME. We call it the shelf. It is not the shelf. Excuse me. And you'll get more information about that with Shandy. So from students that have done very well, I have their feedback that UWorld and BOSS, Dr. High Yield, and the Anki cases did work pretty well for them. We do recommend that the 40 cases are read to prepare for the exam. The 2 clerkship directors in the past that did hand select all the questions for all these versions of the test did confirm that all the information is in those cases, but it is a dense book. It is a difficult read. So if there are especially difficult areas, I would highly, highly recommend that you read those. Also of note, I have worked very hard on the PowerPoints, in particular the 3rd and 4th weeks. And it's a continuous improvement, upgrading of all of the lecture materials. But please do not just brush aside these lectures. Again, I have worked very hard on improving these lectures, and the people that have done well have paid attention to these lectures. The students that have failed in the past, when I asked them what they studied, what they didn't study, they did not study the lectures. So please, please, please do not just brush them off. For the didactics, If you see anywhere anything about bob cases or longitudinal cases, like on this slide, I have just recently nixed those. I for now am not doing those again. I don't believe in just doing busy work, and those were not for a grade at this time. So until I replace it with something else in the future, those will not be included in anything. Otherwise, you'll want to read the FM cases assigned for each session. And submit your EBMs, your click notes, your interprofessional assignments whenever they're due. For the didactic sessions, if you see anywhere anything about a quiz, those are also not for a grade. There's the but you can look at them to make sure that you understand the content of it. And if you have any questions about it, you can always ask about them in your didactic sessions. Okay, and we talked about that. For your EBM assignment, typically, so sometimes this changes depending on the like holidays and such, but typically do 8 a.m. the last day of week 2, and you'll submit it under to Leo. All your assignments you'll submit to Leo. However, if there are ever any issues with Leo, please feel free to email it to Shandy, and Shandy can take care of that for you. And that way there's a timestamp and she'll know that it was submitted on time, etc. There is a template for the EBM on Leo under course materials. And as a reminder, again, that is one of the assignments that you'll do on the same day as your OSCE. I usually try to start the EBM presentations and mid-goal feedback quite early and before your OSCE. Usually we start them at 1 o'clock. I will start them, so I'll be there usually around 12:30, and whoever's there, I'll just start going. So make sure that you do show up before your scheduled OSCE / mid-goal time. Excuse me. The EBM template is there on Leo. If you follow the template, you will do great. Again, make sure that your name is on your assignment, on the saved file as well, the file name on your assignment, and then follow the presentation or the template. I'm sorry. Biggest thing that people get counted off for is, they'll think of some question, but they can't find good quality literature. The literature, it's like 10 years old. And one of the criteria is that the article or articles have to be 5 years or less. So 5 years old or less. So if you can't find that, you might need to go a different route, okay? Or else, because I have to take points off for that. You can use notes. You can have your article there pulled up. You can have your EBM assignment even pulled up, but please don't just read off of it. Obviously I can read by myself. And so I want it to be more of a conversation that you're having with me. You'll start off by telling me what your inspiration is. Tell me about the patient that inspired your question, and tell me what you found out from your article, and then how you're going to apply it to your patient / to your future practice. Okay. And that's your point breakdown. Your clinic note assignment, 8 a.m. day of week 3. Make sure that you do spend some good quality time on writing a good note. Again, if you follow the directions, then you will get a wonderful grade. But if you don't, then I do have to dock points. One of the biggest things that people get docked for is the undifferentiated complaint. That complaint is, so when the patient comes in and when the patient comes in and you say, what brings you here today? It's what that patient says in their exact words, not you rephrasing what they said. Okay? What your rephrasing of what they said goes into your HPI. The undifferentiated complaint or the chief complaint is what they say they are for in their own words. Again, have your name on your file name, and then on your actual document. Again, never fails that on some of these assignments, some of you don't have your name on it, and I have to figure out whose is whose, based off of whose I do have names on. The other piece of feedback that I have is to be looking for this opportunity for this clinic note assignment and for the EBM from day one. Okay. You will have some opportunities where you will get to go in and see a patient by yourself before you go back in with the attending. And sometimes it could be a brand new patient and you get to do a whole H&P. Fantastic. You basically have your assignment done. I know not all of you guys will get those opportunities. And so some things that people have asked is, am I allowed to get some of this information from the patient's chart? Absolutely. Can some of this information be from when the attending goes in and asks them any questions? Absolutely. It doesn't have to specifically be only the questions and answers that you got when you asked them. Also, you may want to be a little bit picky about the patient that you choose. If they're obtunded or it's a very truncated office visit because you have to send them to the ER, probably not the best patient to pick to do this on. I have had notes like that submitted, and probably not the best quality. Okay. And there is the breakdown for your clinic note. All right, OSCEs. Third week, again, that same day, you're gonna do your EBM assignment, medical feedback. There is a document in Leo with a link at the top of the document, with a video of me going over the OSCE information in case you forget a lot of these things that I'm talking about. But of note, there are now 3 stations, not 2. And I will talk about all of that in just a second. So only these 2 stations on this slide are for a grade. And then I'll talk about the other one in a second. So these 2 stations, there is an MSK station and then a counseling station. The MSK complaint revolves around the things that you went over earlier this morning with one of our sports med guys. And on that document, there are the list of possibilities for what you can expect to be the number 1 diagnosis. Okay. As far as the other possible diagnoses, you might need to just do a little bit of critical thinking. And I do want you to list out in order your top 3 diagnoses for what you think is going on based on the history and your physical exam, and then a 4th can't miss diagnosis. So like septic joint or cancer or things like that, something extreme. Okay. For the counseling session, again, there are the list of things that you can expect when you go in for what you were going to be addressing. Okay. For both stations, and I'm going to say it again, for both stations, do an entire history and physical. I'm sorry. Do an entire history for both stations. If you don't do an entire history for the counseling station, you will get docked quite a bit because that is a big chunk of your points. And you cannot do proper counseling if you don't do a full history. You do not do a physical for the counseling station. If you try to do a physical for the counseling station, they will kindly stop you to save you time. Okay, so for both stations, do an entire history. You will only do a note for the MSK station. The extra time that you have when you would be doing your note is when you go back in to do feedback for the counseling station. Okay? Whenever you are getting close to the end, make sure you save yourself time to do a good closure. This is one of the big things that people lose points on, is not leaving enough time for a good closure. For good closure, you need to leave time for the patient to ask questions, but also to assess the patient's understanding. The best way to assess the patient's understanding is by the teach back method, right? So make sure that you leave enough time for all of that, okay? The other major thing that people get counted off on is not asking enough relevant questions in each of the history sections. So if obviously you're not going to have time to ask a million questions in each section, but if it's something about smoking, for example, you might want to know if there's family history of certain diseases related to smoking. There's obesity. Is there a genetic component to their obesity, right? So be thinking about those things. Another thing that people get counted off on for MSK is, let me clarify this. So it is not a requirement for you to verbalize the maneuver that you are doing. Okay. However, to reduce confusion for the SP and to possibly get partial credit, if you say that you're doing a maneuver, but you do it incorrectly, you would get partial credit. Okay. But you were intending to do this maneuver. I would verbalize what you say that you're doing. Okay. We have issues with this every once in a while. So I highly, highly, highly suggest that you verbalize what you're doing as you go. Also, because if you are intending to do a certain maneuver and they think that you're doing something else, then you won't get that proper feedback with them saying, oh, yes, that hurts. Or I'm supposed to tell you that, you're going to feel this whenever you're doing that maneuver. Okay. So again, highly suggest that you verbalize as you go to maximize your point potential. Okay. So there is a third station, and that is the ACE stations. And I say stations because you're going to do one of them and then watch a colleague do one of them. The A stations are adverse childhood events. And the reason we are doing them is because we have come to find that the Oklahoma City side is not getting enough exposure to that. Because I've had even students ask what is an ACE, and that just kind of underlines that fact. Tulsa side gets a lot of this, a lot of exposure to ACEs, and they do these ACE OSCEs as part of their student academy. But we found out that you guys are not getting enough of this. So we just decided to incorporate it into the family medicine rotation. As of now, this is not for a grade, not for a grade. But you will want to do your best because you are going to be not only watched by an SP and being given feedback, but also when your colleagues are going to be watching you. And this is good information going forward to carry with you. Okay. You will get information sent to you. I don't think it's uploaded onto Leo yet. It might be. If not, then Shandy will send you an email with all of the resources to prepare for your ACE OSCE. I believe that is it with that. Let's see. Okay. For the interprofessionalism assignment, do 8 a.m. on week 4. This is just like the EBM assignment, and this interprofessionalism assignment, they are requirements from the dean's office. So we are not things I can just get rid of, but these are the best ways that we've thought of to incorporate them. But it is a typed paper stating these different answers to these things. Basically, you're going to be looking again from day one for a patient that is very complex, a patient that required a lot of coordination. You might have needed to talk to social work or sooner care, or it helped arrange rides for them or figure out how they can afford this medicine and talk to a clinical pharmacist, things like that. And then going forward, how you will use these things in the future for patients. Okay. And if you would so kindly make sure that you use this QR code to take the ACE pre-survey when you leave your OSCEs during that week 3, when you'll take the post-survey. And I believe that is it that I have for you guys. If you have any questions afterward, please feel free to reach out, and good luck with everything. I will see you guys again soon. Bye.